Live from the KHOU11 studios, it's Great Day Houston. And now, here's your host, Deborah Duncan.
It is Medical Monday, and we're starting with an issue that has some parents really angry right now. Other parents see it as a preventive tool when it comes to improving our children's health, though. And here's what I'm talking about. Parents are getting letters from school detailing their child's body mass index that kind of measures your body fat. About 19 states, including Texas, are now doing this. Should the school be getting involved, or should we leave this up to parents? That's one of our hot topics today. To talk about it, please welcome our panel of doctors this morning. Family medicine and anti-aging specialist, Dr. Bruce McClendon. Family and cosmetic dentist, Dr. Terry Alani. Radiologist, Dr. Eric Walser. And orthopedic surgeon, Dr. Brian Flowers. Good morning. Good morning. All right. So, out of curiosity, I'm going to ask, we have several students in our audience this morning. They're broadcast students. Have you all seen these letters that have come home? Yeah, raise your hand if you've seen these letters that have come home. How many of you think that's a good idea as students, that parents know what's going on with their child? Oh, you're like going, no, I'm hitting the vending machine. My parents don't need to know about that, right? All right, so letting parents know about their child's body mass index, which the point of that is?
Well, I think it's important for the parents to be involved. And obviously, they've learned by example. And a lot of times the parents are overweight. They need to get the letter as well. But it's important for the parents to know that their child exceeds a certain weight limit. Not because we're trying to create any other issues other than the fact that it's not healthy.
Yeah, it's not a social stigma we're trying to deal with. It's a health issue.
It's a health issue.
What does body mass index really measure?
It measures the percentage of body fat to your height and weight.
So it could show a sign of obesity.
Yeah. And I don't understand why there's been such negative media attention, naming it fat letters. I mean, for me, we do have to be responsible for our kids, and we entrust our teachers so much as far as, our kids go to school and we expect to have anything that's noticeable drawing attention.
Well, we have eyesight test and hearing test.
Exactly. And the other thing is that, you know what, we do the fat letters or whatever they say. I don't consider them fat letters, but look at the foods that we allow our children to eat in the cafeterias.
And of course, this is a response to what we're seeing is that we used to call it adult onset diabetes, type 2 diabetes. It's now, we're seeing that in children now. And so the point is, if we have children who are that obese, the first generation, I believe, that's not expected to live as long as their parents simply because of things like type 2 diabetes.
And a lot of parents might not be informed or educated as to what the guidelines are as far as for childhood obesity. So I think it's a great idea.
Yeah, what was it? The CDC came out and said that more people are likely to die not from DNA but from family recipes. All right, and so we see obesity impact just about every area of medicine, whether it's dealing with your joints, for example.
Exactly. And on that same topic, that I think that it's important that the patients, the families do have an idea of exactly how their child fits in the realm of their weight.
Yeah.
I mean, as long as the school doesn't go ahead and try to treat or offer suggestions in their nutrition without the parents' consent, I think that it's a good idea.
Yeah, and then also we see how obesity can have an impact on cancers as well.
Yes, it can. There's a lot of links between diet and cancers, and on top of that, I think the school forms a very good alliance with your pediatrician also to help your child kind of know what to eat and when to eat it. Like, don't eat Cokes all day or drink Cokes all day.
Yeah, so let's not forget diet and cavities.
Yes.
Exactly. If you drink lots of Cokes and a lot of sugar, then you're looking at a lifetime full of cavities.
Actually, obesity is probably the #1 disease in our country.
When you think about it,
I mean, half the patients I treat, all of their disease processes come out of the fact that they're extremely overweight.
Heart disease, renal
failure, diabetes, hypertension. And I mean, I'm treating all these as a byproduct of their disease, which is obesity, and I tell them that all the time. Your problem is obesity. You have to control your weight because all these other processes come out of that.
Yeah, and I think a lot of parents are upset about this. The bottom line is no parent wants to be told that they're hurting their child. And so all of a sudden the defenses come up and say, what? I'm not doing this to my child, but if we can take those defenses down and realize what we're dealing with, and this is how serious the situation is. The Joint Chiefs of Staff actually stated that in a few years, because 1 out of 3 kids born since 2000 will have type 2 diabetes, in a relatively short time, we don't even have a standing army. So they said that's a great threat to our national security. Even.
That's a good point,
so,
yeah.
Every step you take, something to keep in mind, the knee sees 3 times body weight. So when you lose 10 pounds, you're taking 30 pounds away from the knee, which can
Wow.
be significant in terms of pain and function.
Yeah, and it could be determined whether you have a knee replacement one day or
Absolutely.
not. Okay, let's move on to our next topic, and that's the overexposure from radiation. I think this is a concern that a lot of us has. You go to the dentist and you get your x-rays, and then you may go someplace else and get an MRI, you may go someplace else and get your mammogram, all that type of stuff. Is there a point where, because no one's ever asked me, have you had any radiation treatment within the last, 6 months, year, whatever, is that a concern, or is it so low that even a number of these things together really aren't a threat to our health?
Well, let me just say one thing. We now have digital x-rays to offer to our patients, which is around 85% less radiation than your traditional x-rays. So it's very safe as far as going to the dentist, and it's much more important to have those x-rays to check to make sure everything is okay in your mouth, maybe once or twice a year, than to do nothing.
Okay.
Yeah, I know the dentists have been very good about doing this, and also in the radiology community, we're very, very driven towards getting dose down, especially to pediatric patients. Those are the ones we really need to protect. And,
Yeah.
and as a radiologist, it's my job to make sure that you don't get overexposed to the radiation. And, just like everything, it's technology now that's driving it. And
Right,
all
right.
the new companies are coming out with very low dose machines. And as in dentistry and in radiology, we're really driving the dose down to almost nothing now.
Yeah, even people who travel a lot, you know,
Yeah.
you have to go through the airport and do this number right here. Right? So getting
In
exposed
fact,
there.
some people going out and getting sunburned get more radiation than they do from a lot of the radiation procedures.
Huh. Good point.
Now, we're also driving procedures as much as we can to other directions. MRI, you mentioned, ultrasound, all those technologies now that don't use radiation are completely safe.
All right. I want to bring up something that kind of hit the news and people just were like, huh? There's a woman who got a flesh-eating bacteria from handling a live crab. And we know we've been hearing a lot in the last several years about flesh-eating bacteria and the whole bit. You can get it from several different places, but handling the live crab.
Well, it's rare to get this, but it does exist, especially in brackish water. You have to be careful when you're handling any kind of seafood. If you get spined or, needled or whatever, or if you're in the water and you step on something, a lot of water around Houston is polluted, and especially down towards the Gulf. A lot of that has this brackish water, and you're more likely. So if you get a cut, you get a scratch, and it seems to get worse very quickly, you need to go to the doctor immediately.
Okay.
That's a good point. I mean, that's something that can rapidly progress, over the course of hours. So I think timely treatment.
And usually it's in someone that is immunocompromised. So it doesn't happen to everyone. And also, as you said, it has to enter through an open wound.
Yeah, but it's kind of like playing Russian roulette. We don't know who it will happen to.
Yeah, but, we eat a lot of shellfish, and we eat a lot of crabs and stuff. So it's not to worry about, like you can't do that. It's just you need to be careful and exercise caution, especially if you're handling them a lot.
Yeah, well, I bet this woman will never make a crab stew again. Okay. She had blisters all over her
Once
hand.
they've
the whole
been
bit.
cooked, there's nothing to worry about.
All right. Well, thank you very much for addressing some of our hot topics here. Our doctors will join us throughout the show to address the health issues they focus on specifically.